Good evening. We are excited that you have joined us this evening for the Tobacco and Nicotine Education webinar. We trust that you will learn a lot. The last workshop I attended, I learned so much. And so we are excited that you took this time out of your busy schedule to be with us this evening. My name is the Reverend Dr. Arlesia Simmons. I'm the East Regional Associate Director with Partners in Health and Wholeness, an initiative of the North Carolina Council of Churches. I will begin with prayer and then I will turn it over to my colleague, Donna Hill, and she will introduce our guest for this evening. So we are grateful for your attendance and let us center our hearts, our minds, and let us pray. Oh, gracious God, we thank you for this day that you have made and for how you allowed us to navigate through it safe and now gather in this digital space. And so we pray for all who are gathered, the faith communities they represent, the organizations they represent, and we pray for those who will join us later by recording. And so, God, open our minds and open our hearts to learn more about this issue so that we can become better stewards of our own temples. Let us not receive this information in judgment, but release us to learn and to embrace new modalities of healing so that your people, the people you love, can heal and be in good health. God, we thank you for this day. We thank you for all who are gathered. We thank you for Ashley who is joining us, and we say amen. At this time, my colleague Donna Hill will introduce herself as well as our speaker for tonight. We are going to ask that you keep yourself on mute and your audio may be muted, and we will have a time for questions later in the evening. So if you want to put those questions in the chat, you're more than welcome to do that, or you can save them for later in the evening. Again, thank you.
Good evening, everyone. I am Donna Hill. I am with the North Carolina Council of Churches on the Partners in Health and Wholeness Initiative, and I work as the project coordinator for tobacco nicotine education as well as opioid response. And we're certainly glad to have you all here this evening for taking time out of your evening to be here with us. Arlesia, thank you for that beautiful prayer and opening. And I want to introduce our speaker for tonight, and that is going to be Ashley Curtis. Ashley, if you can take a second to introduce yourself.
Sure. So I'm Ashley Curtis. I'm the Director of Public Education and Communications for the NCDHHS Tobacco Prevention and Control Branch. That's a mouthful.
Thank you. And I have a couple other of our colleagues on tonight besides Arlesia and myself, and that's Reverend Carolee Hall and also Stephanie Sanders. So thank you all for being here tonight. Our Executive Director, Jennifer, I believe, is on as well. So let's start with the agenda. I'll just give you a brief overview of what we're going to be going over tonight. Ashley is going to start us out with a statement and a little bit of trivia and fun facts. And then she'll continue with her presentation. And then after that, I will talk a little bit about what is Partners in Health and Wholeness if you're not familiar with that initiative. I'll also be going over how to apply for some mini grant opportunities that we have, as well as some workshop opportunities that we have. And then we will do question and answer session, and then we'll wrap up with a closing and benediction, and shouldn't keep you more than an hour, less than that, we hope. So we'll go ahead and get started. And I will hand it over to Ashley.
All right, so we have a few initial statements just to kind of give you an idea of what we'll be talking about today. We want to give you the current state of tobacco in North Carolina and introduce you to the workshops that will be upcoming. Next slide, please. In 2018, 55.1% of adult smokers said that they wanted to quit. What we know about this is that people do want to quit. They just need to know about the resources. Smoking cessation requires compassion. So putting people first and not their problem is the best way to solve the issue, making sure that we know that the people are not the problem. Next slide, please. a little bit of trivia, and what I'd like you to do is just drop what you think the answer is in the chat. So the first question is, which of these products contain the most nicotine? Pack of cigarettes, a disposable puff bar, or a Juul pod? You just drop that in the chat. We've got a Juul pod. Any other guesses? So the answer for this one is a disposable puff bar. It has the highest level of nicotine. These products are disposable, so they look like a USB. They're just a stick that you use the product and then throw them away when you're done with it. Number two, what percentages of people who use tobacco start before the age of 21? Drop your answer in the chat, 60%, 80%, or 95%. We've got a 60. Any other guesses? 60, 80. So it's actually 95%. I know that's a large number. 95% of people start before the age of 21. And we'll get into that a little bit more later on. Teens that vape are how many more times likely to start smoking cigarettes? How many more times likely? Start dropping your answers in the chat. We've got a 3 times. 10 times. Whoa. So it's actually four times more likely. The next question, in 2018, what percentage of adult smokers successfully quit smoking in the past year? What percentage of smokers successfully quit smoking in the past year? We have any guesses? 80%, 40%, 10%? It's 7.5%. So Dr. Sharon Hunter, you were really close on that one. The next question is, e-cigarettes have been the most commonly used tobacco product among youth since 20 what? So we're looking for a year. Any guesses on that year? 2020, 2016, 2017? So they actually were here earlier, 2014. 2014 is the year. And then our last question for trivia, in 2022, about blank of every 100 middle school students and about blank of every 6 high school students reported current use of tobacco. You're looking for one number. Blank of every 100 middle and blank of every 6 high school. So the answer is 1. 1 of every 100 middle school students and 1 of every 6 high school students reported that they currently use tobacco. Okay, Donna. So we're going to jump right into the presentation. We're going to try to focus in on what the products are and then how you can advocate in your communities, 1, for policy, and 2, to help people quit smoking or using any tobacco product. So next slide, please. You're going to hear me use the word commercial tobacco use throughout this presentation, being very clear that commercial tobacco use is products that are created from the tobacco industry. They have cancer-causing agents. They have nicotine. There is also sacred tobacco. So this is used by our Native American population for spiritual, ritual, and medicinal purposes. So we try to use the word commercial rather than just saying tobacco. So that way you can differentiate between the two. Any questions about that? You can drop them in the chat. Up on the screen now, this just gives you a visual of some of the different products that are on the market currently. This is not an exhaustive list, as you can imagine. There's tens of thousands of products. There's the traditional cigarette, there's cigars, there's cigarillos. The things that are in the middle are the e-cigarettes. On the left side, these are called mods, which means you can modify the dose of nicotine that you get or modify the strength of the puff that you're getting and inhaling. And then the other side is showing you some of the disposable products like the Blue Jewel and the puff bar that we talked about earlier. And yeah, that slide's a little hard to see, sorry. The bottom is our spit tobacco, but there's also spitless tobacco, which is things like Zen, which has just nicotine in it and not tobacco itself. Snus as well is a spitless tobacco. And then hookah or water pipe. This is a social tobacco product, typically done in groups. And for 1 hour session of hookah, it's the equivalent of smoking 100 cigarettes. Next slide, please. So when we talk about tobacco, we have to differentiate that we're not talking about the nicotine products that are solely nicotine. We're talking about spitless. We're talking about the products I just showed on the screen. Tobacco can cause up to 13 different types of cancers, and those are highlighted in red on your screen, as well as diabetes. It's been linked to tuberculosis. And it can also cause complications when you have other chronic diseases. It's also recently been linked to COVID as well. So it could exacerbate your symptoms of COVID if you are a smoker. Next slide, please. So tobacco kills 480,000 people each year, and you can see the equivalency on the other side. That's more people than obesity, drug-induced suicide, motor vehicle accidents, alcohol, homicide, and AIDS and HIV all combined. So it's still the #1 preventable cause of death in the United States. However, it disproportionately affects groups that are in minority. Particularly African Americans use menthol at a much higher rate. About 80% of the products that are used by African Americans is menthol. Next slide, please. So what's the #1 product used by youth? And that is e-cigarettes. And I don't think that's a surprise to us. That these products are a lot more flashy. They don't have the same restrictions on media marketing that some of the other products have had in the past. So these are the #1 use product for middle school and high school. The danger here is that kids can switch from e-cigarettes to these other products fairly simply because they're sold in the same stores. And so they easily can interchange these products. Next slide, please. Who's more likely to smoke or use traditional cigarettes? People with less educational attainment, those with lower household income, and those that have systematic issues pressed upon them like LGBTQ, African American, American Indian, those that have been discriminated against or have chronic fatigue or stressors due to outside environmental change, as well as young adults who are under quite a bit of stress as well, those with mental health and substance abuse issues, and those that are marketed to in their communities. Next slide, please. We said this in the beginning, but people want to quit. So there's resources out there for people to quit. Quitline NC is a great resource. They can call, text, or use the website. Also, folks in your churches can refer to the Quitline as a Quitline vendor. And right now, you can also get nicotine therapy replacement. I was about to use jargon and say NRT, but you can get that from the Quitline as well. Depending on if you have behavioral health issues We also have a Native American specific quit line, which is great. They can call that as well. And we're about to launch our Spanish web page for the quit line as well. Next slide, please. So we talked about the person and the product. So now we're going to go into a little bit about advocacy and policy. And so on your screen now are the foundational approaches and retail strategies. Foundational approaches are the things that we know are evidence-based to work in a community. Tobacco price increases, we won't talk about that as much because North Carolina is preempted from working on that at the state legislative level. Smoke-free policies, there's a toolkit that you can use for faith-based tobacco-free, smoke-free policies. It's on the PHW website. Hard-hitting media campaigns, these have been proven to work, especially if you show people who look like the community you're trying to reach. And then cessation access, we know that the quit line works. We have data that if people work with a quit coach with the quit line, that can help during a policy change. The retail strategies below, next time you're in a grocery store or you're at getting gas at the pump, look around at the signage that's in the windows when you're getting gas. Are they lower than the door where a kid can see them? Are they covering the full door? Look at those types of things because those can be used as a policy strategy in your community as well. And then the age of sale, the federal level, the age of sale is 21. In North Carolina, it's 18, which is very confusing. But there's a lot of work to be done with what we are calling T21. So you can always get into that kind of advocacy as well if you're interested in trying to push the needle on T21. Next slide, please. And the last thing I'll say is share your own story when you advocate for tobacco control. I don't think there's many of us that have not been touched by tobacco in general in our lives. And some of the best advocacy is using your own story to tell legislatures and your leaders about why a smoke-free policy is important. We were talking earlier today before everybody got on about third-hand smoke and how smoke can land into the couches you're sitting on, the chairs, your apartment walls, things like that. And a lot of people don't know that it could cause a health issue. And with a secondhand smoke-free policy, and you tell that story, you could get some real impact with policy change. All right, next slide, please. So I've given you a lot of information. And so here is a map of the people that are the boots on the ground in the state. So these are your regional managers. I encourage you to find your county, take down your regional manager's name and number. They're excellent people to come do presentations like we did today. They're also awesome at helping with policy change. So if you want to do a policy change and you're just not quite sure where to start, you can start with the toolkit that Donna dropped in the chat. Thank you, Donna. Or you can reach out to your regional manager and they can help coach you on how to get that policy changed. And I think that might be my last slide.
Thank you so much, Ashley. We'll have time for a question and answer in just a few minutes, but just to go over a few more things in case you're not familiar with the Partners in Health and Wholeness Initiative at the North Carolina Council of Churches. This is what we do. We work to bridge issues of faith, health, and justice across the state, empower faith communities to improve their health and well-being, and partner to support grassroots efforts to challenge injustice. So how do we do it? We provide resources, connections, and support to faith communities for their health initiatives. I'm going to talk a little more in depth about that. We work to establish trust and partnerships with faith communities, and we offer many grants to financially support faith communities in their health initiatives, which I'm also going to speak to. So why do we do it? Because we believe that all people are loved by God, God cares about the wholeness of humanity and communities, mind, body, and spirit. And our work in partnership with faith communities will improve health outcomes of people across the state. So let's talk about the mini grants and how to apply for that. The first step that you have to do to apply for one of our mini grants, if you're not familiar with that process, is to join the Partners in Health and Wholeness Collaborative. And you do that by completing a collaborative pledge and clergy commitment. So the collaborative is open to any faith community that worships together on a regular basis in a physical location in the state of North Carolina. You submit your collaborative pledge by November 16th to be able to apply for this round of grants by November 30th. And to get started, you just go to our website, and it's listed here on this slide, but it's healthandwholeness.org/collaborative. And we can always get you that website. And then the second step is, once you've applied for the collaborative pledge and you're approved, then you're eligible, you'll receive a link for one of the grants to be able to apply for the grant. And thank you, Stephanie, put the website in the chat. So how are you eligible to apply for a mini grant? So you just have to be an active member of the collaborative pledge, and that collaborative pledge has to be on file within the last 12 months. And you also have to not have already received a mini grant within the last 12 months. Those are the two eligibility criteria for applying for a mini grant. So you just submit your mini grant once you get that link, and then you will hear from us after that. But we wanted to let you know we do have a grant writing 101 workshop coming up, and it's on Thursday, October 26th at 7 p.m. And that information will be on our website. So we have some different grants that you can apply for. You can apply for just a regular grant through PHW, where there's 7 different focus areas on health initiatives that you can apply for. And then we also have focus area specific grants. And for the focus area specific grants, those are on tobacco nicotine initiatives and opioid response initiatives. So just to kind of give you an idea of the different tobacco initiatives that you can apply for, this is kind of just a menu of sample ideas. You can have a town hall forum where you have a youth-led photo voice project, which if you haven't heard of photo voice and seen youth do that, it's a really cool thing. It gives you kind of a sample budget. You can also purchase tobacco-free signage if you're implementing a tobacco-free policy on your grounds at your church or faith community. You can have someone in your congregation get trained to be a tobacco treatment specialist, or get trained in Catch My Breath, which is a youth vaping cessation curriculum. And then the other idea is that you can promote Quitline and the different quitting cessation programs that are available in the state of North Carolina. And then for the opioid initiative, some examples of things that you can apply for as far as that goes is, again, have a town hall meeting or forum, and that can be based around things like harm reduction, the opioid settlement money in your community, what's going on with that and what you want to happen with that, the Good Samaritan law and policies around that. Or just education and updates on the opioid crisis. You can also do a medication take back day. With that, you do have to have law enforcement present, so you would work with law enforcement on that. You can do a naloxone training and purchase some naloxone for distribution. Naloxone, in case you're not aware, is the life-saving medication that reverses an opioid overdose. And then you can even start a book club or a study group. And then you can also host recovery groups in your church and support the recovery community in that way, such as AA or NA groups like that. So applying for a grant, you need to, again, make sure that you have your collaborative pledge submitted by November 16th, because the last day to apply for grants is November 30th. And so once you've submitted the collaborative pledge, then you will get a link to apply for the grants. And if you have any questions about applying for grants or submitting the collaborative pledge, please reach out to Stephanie. She's just put her email address in the chat, so you can copy and paste it somewhere so you have that. If you have specific questions about the tobacco and nicotine initiative mini grants or the opioid response grant mini grants, specific to what you can do, you can reach out to me for that. And my email is in the chat as well. And lastly, I wanted to talk about the workshops that we're having, and we've had several already. We're planning for several more. And this is where, when Ashley was talking about the regional managers and showed that map of regional managers across the state, I would bring in regional or local experts to talk about this content. So with a tobacco workshop, it can be specific to youth and vaping or tobacco in general. It can be targeted to youth, parents, both. And then with the opioid workshop, we could talk about what's going on in your local area. Like, what do those statistics and data look like currently? And what are some things that your congregation can do to respond to the epidemic? And the opioid crisis in your area, whether that's, some of the things that we already talked about on the menu of options that you can apply for a mini grant, or whatever that may look like in your community. And we can talk through those things about how does the faith community respond to that. And so that's kind of what those workshops are for. We can bring people in with some food and have an 1.5 to 2 hour workshop for the congregation and the community. And Stephanie put a little bit more information in the chat there. So what are questions that you have about all the things that we've talked about, things that I've talked about or Ashley's talked about? We're going to open the floor up for questions.
Good evening. I'm Sharon Hunter. Let me see if I can get my picture back here. It's kind of jumping around. Well, anyway, I want to find out if you've already submitted a pledge. Is that pledge transferable to another grant, or do you have to do another collaborative pledge?
As long as you've
I can jump in on that one. Sorry, Donna. If we have a collaborative pledge from you within the last 12 months, that is sufficient to apply for one of these grants. If you wanted to maybe direct message me or just put in the chat the name of your faith community, I can look at the status of your collaborative pledge and let you know exactly where you stand. I can follow up with you via email.
Thank you.
You're welcome.
And I just put that in the chat for you.
I see a hand raised by, is it Merle Jones?
Yes, thank you.
Sure.
I have a question. Are you allowed to do a combined tobacco and opioid together for a mini grant, or they have to be separate?
So those are separate grants, so you would do one or the other. Now, what I will say too, though, is that the workshops that I provide is separate from the mini grants. So if you wanted to apply for a mini grant for tobacco nicotine initiatives, but you wanted to learn more about the opioid response, then I could come and do a workshop for you on the opioid response to be able to get, a lot of information and education about what can be done. And then maybe, if we have funding for that the next cycle, then you could apply for that next time if that funding continues. It's always contingent on that. But the workshops are free. They're not at any cost to you. So I wanted to let you know that as well.
Oh, okay, great. I have one more question. How do you find out the statistics for your area as far as opioids is concerned?
So if you go to the North Carolina Department of Health and Human Services, if you Google opioid dashboard for them, I'll put that in the chat. You can go to that dashboard and see statistics by county for the number of deaths, the number of hospitalizations, ED visits, things like that. And I'm going to put that in the chat.
Thank you.
Will you all be sending your presentation out at the end of this session?
I'm okay with doing that. Ashley, can you are you okay with us sending your slides out as well?
Yeah, that's fine. Yeah.
Okay, we can do
Thank
that.
you. Thank you, Ashley. Donna.
Anybody else have a question about anything?
It was very informative, and I did learn a whole lot. I did not know what the SMHU um, use of that drug was. I had no idea what that was. I've never seen that. And what kind of form does that come in again?
So it's in a pouch. The product's in a pouch, and they slip the pouch into their lip, just like if they were using regular dip tobacco. Mhm.
And that's just found in your regular tobacco stores?
Yes, ma'am. Yeah. Just in the
Wow.
regular, you can get it at the grocery store or
Mm.
the gas station. Mhm.
I'm sorry.
Hello, everybody.
Hello, I'm sorry. Is the grants are still open for the opioids? Right.
Yes, ma'am, through November 30th.
Thank you.
Hello, everyone. My name is Christy Stith Banks. I bring you greetings from Building Bridges of Hope for Ministry. I just came into the webinar because you just can't stop learning and getting familiar with what's out there. The reason why I'm chiming in is because my biggest concern is, of course, in I'm gonna use Johnston County. In the Johnston County area, there's a big situation with opioids. However, the ministry that God has blessed me with, it covers several different counties. But my question is in regards to faith communities, and I was happy to hear about the Quick Talk line per se. I wanted to know, is it possible through this quick line to get like some patches that's free while we're waiting to become eligible to apply for this grant?
Yeah, I can take that one, Donna. So depending on your insurance, you can get up to 8 weeks free of patches. And then uninsured also gets 8 weeks of patches. I believe right now, the behavioral health conditions track is also 8 weeks of patches or gum. But I can double check that for Donna. Donna may know off the top of her head. But I know that there's different ways to get the nicotine patches through NC Quitline. Also, military can get NRT, as well as on the Native American Quitline that I was talking about. Also, I believe gets 8 weeks of nicotine replacement. So there are ways for you to get it through there as well.
Thank you, because I've been researching that for quite some time, longer than here. But thank you so much.
Yeah, that sounds right. The 8 weeks is the last thing that I heard, Ashley. And is it just the patches, or can you also get the lozenges in the gum, or are they just doing patches right now?
I think it's either or, depending on what you want. So at either lozenge, gum, or patch. Yep. And I went ahead and dropped that website, quitlinenc.com, in the chat. If you go there, then you can see what all is offered, as well as there's some printable products that you could print and hand those out. You can also reach out to those regional managers I dropped in the chat, and they can bring you printed copies as well, if that's helpful.
Mm-hmm. Okay, because I've been navigating, not take up too much time, but working on a health fair. And one of the things that I did at least want to do is to have some signs up and signs in place. And so I was researching that toolkit. So just go online, place an order to get it sent to me, so I have it for the health fair.
Which county are you in?
The healthcare is going to be done in Edgecombe County.
Edgecombe County. Okay, so that's Region 7. That's going to be Deidre on that map. So if
Okay.
you reach out to her directly, she should be able to get you some stuff. But if you go to the website that I dropped in the chat, you can print whatever you want off of that as well, if you need them sooner. But Deidre is going to be your regional manager.
Got it. Thank you. Bless you.
There's a question, Ashley, in the chat. I'll let you take.
Yeah, so the question is, since the federal legal age is it's nighttime, y'all, is 21, are all tobacco stores, vape shops following that? Are they still at the age of 18 in North Carolina? So yes, and it's a very confusing, and I'm not the policy expert at our branch, so I would love to send you guys some resources through Donna, but it's very confusing, and we could do a whole webinar on that as well. But basically, we do have to follow the 21. However, they're not going to be penalized for selling below 21, if that makes sense. So the state law is 18 and the federal law is 21. We follow the state law. And so that is what is in place currently, and that is what we're still following until we get to that grace period to where we'll be penalized at the federal level for following our own state law. So it gets very mucky. So I'd rather just send you some concrete information that you can read through on that T21 piece.
Yeah, that gets a little mucky. And if you think of any questions after the webinar, you're welcome to reach out to Ashley or myself. And if you're interested in one of the workshops, reach out to me and we can work on getting that planned. Does anyone have any last questions? And if not, we will get done early tonight. Okay. I'm going to turn it over to, thank you all so much for spending your evening with us. And I'm going to thank you to Ashley for coming and speaking for us and for my colleagues who are on the phone as well. And I'm going to turn it over to Reverend Carol Lee to have her do the closing and benediction.
Could you wait just a moment? What's your title again?
So I am project coordinator for tobacco nicotine education and opioid response.
Okay, and your full name?
Donna Hill, Hill.
Okay, thank you.
And I can put my email in the chat. I'm not sure I have, so I'll do that right now.
Yes, thank you so much for joining us today, and thank you for joining us in this work of health and wholeness and leading our communities towards wholeness of mind, body, and spirit. And so I invite you to receive now this benediction as we close our time together. May the God of hope fill you with all joy and peace so that you may abound in hope. May the God of encouragement and endurance grant you to live in harmony with one another. And may God bless you to be a blessing to those around you. Amen.